How to treat trench foot. Trench foot, also called immersion foot, develops when your feet are exposed to cold, unsanitary water for long periods of time, many hours or days. It was termed during World War I when thousands of soldiers developed the painful condition while fighting in the trenches. The condition is characterized by foot swelling, numbness, pain and eventual tissue death and gangrene, which is life-threatening. Trench foot still occurs in modern war zones, disaster areas and outdoor events mired by rain, flooding. Treating and preventing the condition is pretty straightforward. Treating trench foot. Check for symptoms. Trench foot is caused by having wet feet for long periods of time, due to things like having wet shoes and socks or standing in water or mud for a long period of time. If you start to notice symptoms of trench foot, then you should seek medical attention as soon as possible. Symptoms of trench foot may include the following: tingly or itchy feet, pain in your feet, swelling feet, cold blotchy skin, numbness, heaviness, or a prickly feeling in your feet, redness and warmth, dry skin, blisters followed by tissue death late stage. Wash and dry your feet frequently. Although trench foot was termed over 100 years ago and seems to be something of the past, it can still occur in people who spend many hours in cold, wet conditions. One of the best ways to treat trench foot is to keep your feet dry and clean. If you find yourself standing in water for a few hours or more, clean and dry them as often as you can. Change into dry socks as needed. Trench foot develops because the blood vessels of the feet constrict in an attempt to keep the rest of the body warm, which reduces the amount of oxygen and nutrients the tissue gets. Without adequate oxygen and nutrients, the tissues of the feet swell and eventually die. Bacteria in the water can also trigger infections if there's cuts or abrasions on the feet. If you do have cuts on your feet, apply some antibacterial cream or alcohol-based sanitizer after you dry your feet, but before you put your shoes, boots back on. Trench foot develops because the blood vessels of the feet constrict in an attempt to keep the rest of the body warm, which reduces the amount of oxygen and nutrients the tissue gets. Without adequate oxygen and nutrients, the tissues of the feet swell and eventually die. Bacteria in the water can also trigger infections if there's cuts or abrasions on the feet. If you do have cuts on your feet, apply some antibacterial cream or alcohol-based sanitizer after you dry your feet, but before you put your shoes, boots back on. Warm up your feet. If you've been standing in cold water for hours at a time, it's important to not only dry your feet, but you need to warm them up gradually. The heat will open up, dilate blood vessels and increase the circulation to your feet, which will stop the progression of trench foot. Apply warm packs or soak your feet in warm water for approximately 5 to 10 minutes. Resist the urge to use hot water because you may scald your feet and make the condition worse. If you take a warm foot bath, add some potassium permanganate solution from your local pharmacy to the water. It can help draw fluid out of the swollen tissue. Affected area. Trench foot is similar to frostbite, although it doesn't require freezing water temperatures. It can develop in water temperatures up to 60 degrees Fahrenheit, 15.6 degrees Celsius, and even occur while indoors. Trench foot can take less than a day of water exposure, as few as 12 hours to develop. Take off your socks while sleeping and resting. Once you've warmed your feet up, it's important to keep your socks off initially while you rest and sleep in your bed. This may seem counterintuitive for cold feet, but wearing tight socks can reduce blood circulation and make trench foot worse. After a few days of recovery, you can wear loose socks made of breathable material, such as cotton. Instead of socks, keep your feet warm while resting by covering them with a wool blanket. Don't elevate your feet while sitting on the couch because you want to encourage blood flow to your lower legs and feet. While lying in bed at night, add another blanket to the bottom of your bed to keep your feet warm. Try not to cross your ankles because that can slow circulation to your feet. Consider over-the-counter medications. Trench foot is characterized by tissue swelling and pain that can become quite severe. It can affect the toes, heel, or the entire foot depending on which parts of your feet are wet and for how long. As such, take medications that can combat the pain and swelling, such as anti-inflammatories. Ibuprofen, Advil, Motrin, and/or naproxen Aleve are common over-the-counter types that work well. Anti-inflammatories work best and are safest if taken for short periods of time, less than a few weeks. Once trench foot sets in, it can take between a few weeks to several months to fully heal, depending on the severity and the overall health of the person. Anti-inflammatories work best and are safest if taken for short periods of time, less than a few weeks. Once trench foot sets in, it can take between a few weeks to several months to fully heal, depending on the severity and the overall health of the person. Treat any signs of infection quickly. The main signs of trench foot: pain, swelling, blistering, color changes typically errant due to infection, although standing in water contaminated with bacteria from feces certainly increases the risk of infection, especially if you have any cuts, nicks or abrasions on your feet. Other signs of infection to look out for include bloody pus discharge, red and/or white streaks on your feet, foul odor and mild fever. If blisters form with trench foot, the likelihood of infection developing is significantly increased. If you are at risk for trench foot, apply an antibiotic cream or sanitizing lotion to any cuts or abrasions on your feet as soon as you can. Your doctor may give you antibiotics to prevent infection or even a tetanus booster if your vaccination record isn't current. If blisters form with trench foot, the likelihood of infection developing is significantly increased. If you are at risk for trench foot, apply an antibiotic cream or sanitizing lotion to any cuts or abrasions on your feet as soon as you can. Your doctor may give you antibiotics to prevent infection or even a tetanus booster if your vaccination record isn't current. Seek emergency care if your feet turn dark blue, green or black. A greenish-black discoloration of the skin on the feet indicates that tissue is dying from not getting enough oxygen and nutrients for too prolonged a period of time. Tissue death, also called necrosis, can quickly lead to gangrene, which is a medical emergency needing antibiotics and likely surgical intervention. In addition to dark discoloration, other signs of gangrene include further swelling, severe pain, then a loss of sensation, peeling away of skin, foul-smelling discharge and disfigurement of toes. In severe cases of trench foot where gangrene has set in, foot and lower leg amputation is usually required. In addition to dark discoloration, other signs of gangrene include further swelling, severe pain, then a loss of sensation, peeling away of skin, foul-smelling discharge and disfigurement of toes. In severe cases of trench foot where gangrene has set in, foot and lower leg amputation is usually required.